Good afternoon. My name is Mark Levine, and I am the Deputy Director of your New York State Association of Counties. On behalf of our President, Jack Marin, the President of the New York State County Executives Association, Dan McCoy, and our Executive Director, Stephen Aquario, I want to thank you for joining us this afternoon for a virtual fall seminar workshop about leadership in the time of COVID. We have a great workshop, Stories of Local Leadership, in store for you this afternoon. This is day 3 of our virtual 2020 fall seminar, which is taking place through the end of September and includes 20 workshops and meetings designed to bring the latest information on issues facing today's county leaders. We encourage members to show your participation in the fall seminar by joining in our virtual contest for a chance to win prizes from our sponsors. For those of you on Twitter, we have a weekly tweet off. Whoever tweets the most times throughout the week using the hashtag #CountiesForwardTogether will win a prize from our sponsor. This week's tweet off prize is a JBL Bluetooth speaker. For those of you on Instagram, we're hosting a Counties Forward Together photo contest. To participate, simply post a photo about how your county is moving forward with the hashtag #CountiesForwardTogether and tag us at NYS Counties. A winning photo will be selected at the end of the conference and win a prize from our sponsor. To learn more about these contests, visit nysac.org/contests. Leadership in the time of COVID-19. They say that hindsight is 2020. With the onset of COVID-19 pandemic nearly 8 months ago, county leaders now have an opportunity to reflect on the lessons they learned from the darkest days of the pandemic, as well as best practices and things they may do differently if there's a second wave. This session will discuss the lessons learned from what is arguably the most challenging public health and economic crisis of our time. We're joined this morning by 2 distinguished presenters who are leading at the local level during the pandemic, and I will introduce them to you in just a moment. First, I want to take this opportunity to thank Siemens for sponsoring this session. If your capital budgets are stressed, Siemens can leverage the money in your utility expense line to fund your capital infrastructure needs. You are already spending the dollars for electricity, gas, and fuel. Why not redirect some of that to make your buildings healthier, safer, and more resilient? Contact Siemens today and ask how their smart infrastructure program can help your county. Please join me in thanking our sponsor, Siemens, for helping us make this workshop possible and our fall seminar available to all NYSAC County members. A word about the webinar. If you have questions during the presentation, please type them into the question panel in your webinar dashboard, and we will take them up after the speakers finish their presentations. At this time, it's my pleasure to introduce our first speaker. Pat Ryan is a 5th-generation Ulster County resident and the Ulster County executive. After graduating from Kingston High School, Pat attended West Point and served 2 combat tours in Iraq as an Army intelligence officer. Thank you, County Executive, for your service. After leaving the military, he founded a small technology company which grew to over 150 employees. County Executive Ryan has shown tremendous innovation in this unprecedented time, and we are looking forward to hearing about this experience leading through this global pandemic. County Executive, thank you for joining us.
Absolutely. Thanks for having me. Can you hear me all right? I know we're all still figuring out Zooms and GoToMeetings and all those things. So one of the many things we didn't expect we'd be doing in 2020.
That's right. Loud and clear.
It's really a pleasure. Good. Well, it's a pleasure to be with everyone, especially with my esteemed colleague, County Executive Vicente. Thanks, and good to see you virtually. And looking forward to hearing what wisdom you can share. You know, before I start, I do want to thank NYSAC. I am a new county exec. I'm just finished my first year. and to be able to rely on the information, the resources, and really just the network that NISAC has brought together during this crisis was absolutely a difference maker for my team and I. So I want to thank Steve and Mark and the whole team and all the membership. You know, there was a while there where we were all talking every day and sharing lessons, and that was hugely valuable. So thank you to NISAC and to all my colleagues and fellow public servants on the line. Thanks for joining. It does feel a little weird in some ways to be having this conversation because we're still in the midst of this crisis. So anything I say today, I just want to have sort of two caveats. Number one, we are learning as we go, building the airplane as we fly it, whatever analogy you want to use. So, you know, take all these thoughts and lessons with a grain of salt. And number two, I feel, you know, we've all each been through this as leaders and public servants. And so, you know, I just want to say that by no means do I have this all figured out or, you know, have a corner on all the good ideas, but I'm excited to share what we've seen and learned and hopefully hear from you all too. So without further ado, I'll jump in. I mean, I have a few slides to just kind of guide the conversation, but mostly we'll just kind of share a few things. If you'll hit the next slide, please. I wasn't sure if there was a chance to introduce myself, which already happened, so I can skip over that. All I'll say is, as really the new guy, probably one of the newest county execs, I ran for public office because I wanted to serve in a challenging time. I didn't quite anticipate it would be quite like this in the first year. In addition to managing COVID and everything else, we also have a 14-month-old, our first child at home. So I assure you it has not been a boring year in the Ryan household. But I also really feel that for all of us, this is why we sought you know, public office and public service, to be able to lead our communities in a time of crisis. So even in the craziness that we're dealing with, I really do feel honored and blessed to have this opportunity, and I'm sure many of you feel the same way. I want to share, next slide please, just 4 kind of lessons, and I'll briefly hit on each of these and share some anecdotes about what we learned and what we saw, what we got right, what we got wrong, in my opinion. And we'll kind of frame it that way, and then happy to answer questions and just kind of have a discussion. I will say a lot of these lessons and anecdotes, and even some of the terminology I've used, I've really relied on my military experience, especially as a new county exec, to lean on lessons I learned in combat as a leader. Really was a difference maker for me. So pardon some of my, you know, references back to Army terminology, but that was helpful for me anyway. And we each lean on our own experiences, of course, as we respond in different situations. So the first lesson, next slide please, for me, is really about planning. There was a phrase, a half joke phrase that I was taught as a young officer. It's called the 6 Ps. And pardon my language, but prior planning prevents piss poor performance. That was something drilled into us as West Point cadets and young officers that mirrors kind of the quote that I put up there from General Eisenhower. This idea that a finished plan document is often not super useful, but the process, the work that goes into planning, thinking about contingencies, bringing teams together, wargaming things out is invaluable. So for us, one of the big takeaways was early on, going back to mid-late February, as we started to hear reports out of China and around the world, what was happening. I actually called my whole team, all my department heads and key leaders in our government. And to give you a sense, we're a medium-sized county. We got about 1,400 employees. We all came together. A lot of my team thought I was crazy because at the time there was really no cases in the U.S. And we did a series of tabletop exercises where we dug out an old influenza plan, tried to work through hypothetical situations and update that plan. And then we also realized in that process as a government team that a lot of what would need to be done couldn't be done by us. So one of the big do-outs and follow-ups from our internal tabletop was we scheduled a series of meetings and tabletops with a whole network and host of other community partners, and really saw this as a whole of community kind of effort. So the approach that we ended up, excuse me, I'm sorry. Oh geez, forgive me. That's terrible timing. I apologize. Hold on. I'm very sorry. Jeez. Forgive me. I'm sure we can all commiserate with that. I think the model that we realized quickly coming out of this was that, again, we were going to need to organize ourselves differently. And the approach that I relied on, next slide, please, was really something that's been talked about in a few different ways. But we over time worked through and realized we were going to have to create what many leaders have called a network of teams or a team of teams, where using the traditional organizational structure of government for a crisis like this just was not going to work. So, you know, that's obviously another big takeaway for us, where we saw ourselves as driving action, but in many cases we knew we were going to need to rely on partners to do a lot of the work. But all of that, to just close on this first takeaway, all of that was really born out of some of the initial planning and tabletops that we did before we had any cases of COVID in New York State or in our county in late February and early March. And I look back on that as one of those good decisions that we did make, and one that we've continued to do throughout at different key phases, get the team together and do those tabletop exercises. Next slide, please. The second lesson for us is this idea that, especially in a crisis, it's very easy to have paralysis by analysis and overthink, and with imperfect information, essentially to just wait and sit. I very much believe, especially in a crisis, it's even more important to be action biased, and that's really the approach that we took. And as we've started to see the crisis unfold locally in Ulster County, to me it became clear quickly that those early decisions in the early days were going to have outsized impacts way downstream, down the road in the coming months and years. So just to give you a sense of what happened here, we had our first known positive case on March 8th, which was a Sunday. And that's when we triggered our plans that we had worked through. Of course, those plans were quickly, again, sort of blown up, but at least we had done some of the preliminary thinking. By March 12th, a few days later, I declared a state of emergency, and we were one of the first to do that. And then the next day, in coordination with my two brother county execs in Orange County and Dutchess County, we made a hard decision before most anyone else had, and definitely before the state had, to close our schools at least for an initial 14 days. And I think several of us did do this early, and I believe pushed the state to move more quickly on this. And looking back and talking to the experts, there's just no doubt that saved lives, even just a few days of doing that, because we know those schools and the interactions with parents and teachers were such a critical vector for spreading COVID. So again, making that decision early when it was super uncomfortable and when we were very worried really paid off. We also had a similar dynamic with our testing, where many were waiting for the state to set up testing sites. I believed, and was proven right, that if we waited for that, you know, don't hold your breath and checks in the mail lost somewhere. So we again took initiative and decided to set up our own county-run testing sites early. And by March 22nd, you know, basically 2 weeks in, had our first testing site up in partnership with our hospital partners, which again we believe let us rapidly scale our early testing and then quickly isolate and contact trace and so on. So again, you know, bringing it back to the large takeaway, easy to say, the phrase, you know, be action biased, but it's clear to me, and I think to all of us at this point, that the decision to wait is a decision in and of itself, and that acting, maybe getting it hopefully 75% right, but acting, learning, assessing, and iterating are key, of course. The third takeaway of the 4 big takeaways from us and from me is about communications. Next slide, please. Again, I think this is something a lot of us experienced. How do you do crisis communications? How do you do it when no one can get together? How do you do it when at the national level there was at best, you know, confusion and a vacuum of information, and it really meant us as local leaders stepping up and filling that void. So my philosophy was early, often, and with empathy. I mean, those were the key aspects that I thought about in how we communicated and when and how often. And the big wake up call for me. So we had our first case March 8th. A week later, we held what was a telephone town hall. We worked with a software company that set up a you know, a teletown hall, which I'm sure many of you have utilized. I had never done one, and we did it on a weekend with the idea that we had been getting lots of questions. Obviously, we were a week into the crisis, and we had just closed schools and declared a state of emergency, so we knew there were lots of questions. We anticipated we'd have maybe a few hundred people at most join this call. We've got about 200,000 residents in the county. So I'm sitting there watching this thing start up, and the number of callers dialing in is just going up and up and up and up and up. We had almost 15,000 people call in live to this thing, and it was this wake-up call moment for me. It was very clear that, especially in this crisis, people were desperate for information. They were desperate for some sense of direction and leadership, and you know, what I tried to balance as sort of a sense of calm and deliberateness, but also some optimism that we were going to be able to get through this, and some just genuine humanity of when we did lose folks, to just take the minute to share in that pain. When we didn't know something, to just say, look, I don't know. I don't know yet. We're working on it. We're going to let you know when we know and when we're doing our best. And I think people really did appreciate that. And I'm sure many of you experienced that. I have now done, probably like many others, I think approaching 100 public updates using Facebook Live. That proved to be a very useful tool for us. And we're still doing those. I did one earlier today, and plan to do that really until we probably have a vaccine and feel confident that we're out of this. We did that through all the reopening. We did, you know, through all the different pieces as we're now dealing with the school issue. It's just been critical at each step that we can hear from people, answer their questions, and also present a clear plan in our response. And the last thing we did that I wanted to share in terms of communication, 3 days in, before we did the teletown hall, our phone lines were just getting absolutely overloaded, slammed with calls, mostly just about basic public health information. What is this virus? How does it spread? How does it not spread? What should I do? What precautions should I take? And we just, you know, we were not resourced to handle that flood of calls. So we, next slide, please. We stood up a very ad hoc. We called it initially just a hotline, and this is one of the photos from the first day. You'll notice, by the way, and it's weird to see this, but none of us had masks on. We were all in one room together, probably not a great idea looking back, of course. But this is probably, 3 days into the crisis. We commandeered a big conference room, set up a board. We were tracking all the data points and all the cases. We had volunteers staff this, some of our employees, but also just residents of the county. And getting this up quickly, and we were getting hundreds of calls a day. This was a critical way to not just proactively push out information, but for people to feel like there was a human being there that they could call, and even if we couldn't answer their question, that there was at least someone who cared, especially for homebound seniors or those struggling with whatever challenge they were struggling with. That proved really important. In the preceding months, we've now had over 30,000 calls into this hotline, and we've set up a very robust, actually, ticketing system where now every call in, we track our response time. It also gives us a sense, and me a sense, of what are the challenges people are now feeling. So over time, we've shifted from COVID health calls to I need food, I need shelter and housing, I'm having a mental health crisis. So we've been able to actually create almost an easier interface point, which we might end up building out into what I know some of you already have, which is a 311 type of system. But this has proven very useful for us. And then the last takeaway from my perspective, lesson learned, next slide please, is again something I learned from my first boss in the Army. He always used to say, if you're not uncomfortable, you're probably not doing it right. And I know all of us have felt some sense of this probably almost every day. I know I have, that if in a crisis you feel like you've got it under wraps, then that means you're probably not understanding the scope of the problem and your role in it. I really relied on my two different experiences. One in the world of the military, where we use this thing that you'll see on the left screen of your screen called the OODA loop: observe, orient, decide, act. It's really, an iterative cycle. This goes back to a 1960s era way of thinking, designed by a former fighter pilot. The idea that basically you need to have rapid cycles of make a quick decision with what you have, limited information, adjust, and then keep going. In the 21st century version, we see this in software companies like the one I founded and led, described as an agile methodology or a lean methodology, but it's all really the same thing. It's don't over design up front, don't try to think through everything, which often we do as government. Take a first step. It's going to be imperfect. Learn from that step, and really kind of hack the system. Because what we saw in one of our specific initiatives, which I'll talk about here in a second, many of the systems that we've built as a government are brittle, are not really designed to be flexible and agile, especially in a time of crisis, to meet an unexpected need. One of our biggest gaps, next slide please, was on food, which I know all of us experienced. We had thousands of households out of work, already straining before COVID, and now with no money to put food on the table, the most basic need, along with security that all of us need as humans. And we all know our existing systems just were not ready to meet this need. So what we did 3 or 4 days in is try something totally different, which was a really outside of government approach, where we set up something called Project Resilience and raised community and philanthropic funds to build a new system to deliver food across our county. We partnered with an existing tech company to build a technology layer for this. We raised in the first 48 hours over $2 million in grassroots and philanthropic funds. And then we had hundreds of volunteers, all taking risk themselves, delivering food to people's doors. So, you know, many of us have seen these photos of miles-long lines of cars at food banks or food sites in Ulster County. Because of the ingenuity of our community, we were not only not doing that, we were delivering meals to people's doors that were prepared by local restaurants. And that actually helped our restaurants stay open as well at a critical time, because we were paying them for these meals at a rate that let them at least get some revenue and keep their employees on board. This is a system that never would have sort of been possible under the structures and the bureaucracy of many of our existing systems, which have their place. But in this crisis, we really had to innovate and set up a new approach. We've now pivoted our food delivery efforts to childcare through Project Resilience as we've gotten back to school, and we're now working working with our local childcare providers and setting up grants and scholarships for families that can't afford to cover the childcare costs. Another kind of hack around the system that we've been able to figure out, and you know, who knows what we'll do next. But this kind of public-private, but really more private than public, honestly, structure has allowed us to be agile and innovative and serve the public good in a way that we just never would have been able to do. And again, that really, to me, goes back to this idea that if you just rest on the systems you have in a crisis and you feel confident that that's going to meet the need, then you're setting yourself up for failure. You have to be willing to get uncomfortable. So I've gone on quite a bit here. Those were the four high-level, I know, lessons and a few kind of anecdotes to illuminate them on the ground here in Ulster County. The last thing I'll just say is that undergirding all of this, I believe, is important to have a set of ethics and an ethos of what I call servant leadership, which is what I've tried to imbue in our team, this idea that we're each doing this to serve our community ahead of ourselves. And that ethos and culture in a moment of crisis is what allowed us to really step up and ask our team to do more. And you know, that is an undergirding piece of our response. So I'm really proud of what we've done. We didn't get it all right, but you know, our whole team worked our butts off, and I want to thank my whole team here in Ulster County and each of you and your teams for guiding at the local level. I mean, we were the front lines of this thing. We all know that. So thank you for what you've done, and thanks for listening, and look forward to the discussion.
Thank you, County Executive. That's a great way to end your part of the presentation, the public servant aspect of our leadership at the county level. And we at NISAC, we appreciate that very much. And we are pleased to be here to help you serve the public and help all of you on the line serve in your counties. So thank you, County Executive. And somebody who has studied organizational communication and organizational development. Really appreciate the hub and spoke model that you talked about early in your presentation. I think there's no shortage of things that we can study going forward, but we're still in the midst of this, and we're still looking at lessons learned and best practices. So thank you. And now I would like to introduce our next county executive to speak about how he led his county through COVID-19 pandemic. Anthony J. Pesenti Jr. is the 13th Oneida County Executive and the longest serving in the county's history. He was appointed to the position in 2006, followed by his election to a full 4-year term in 2007, 2011, 2015, and again in 19. Mr. Pesenti is the longest serving county executive in the state of New York. He is a past president of the New York State Association of Counties, as well as a former president of the New York State Association of County Executives. During his tenure as Oneida County Executive, Mr. Pacenti has improved the county's financial outlook and credit rating. He's also been a statewide leader in consolidation efforts and initiatives. Through these efforts, he has been able to keep taxes in line with while increasing the efficiency and effectiveness of services his government provides the residents of Oneida County. He has focused on advancing economic development in the county in such high-tech areas as nanotechnology, cybersecurity, and unmanned aerial systems at the former Griffiths Air Force Base and in other areas in the county. He has created the Vision 2020 initiative, bringing together stakeholders from across Oneida County, from promoting job opportunities as well as education, training, and housing alternatives. Vision 2020 has now expanded to deal with transportation issues, including connectivity, alternatives to automobiles, and access. County Executive Pacenti was instrumental in the state and county's reaching of an historic settlement in 2013 with the Oneida Indian Nation. Mr. Pacenti, who attended Utica Public Schools, holds an associate degree from Mohawk Valley Community College and a bachelor's degree from Utica. Thank you, County Executive, for joining us this afternoon. We look forward to your presentation.
Thank you. Thank you, Mark, and I hope you can all hear me well. And I want to thank NYSEC for the opportunity and certainly for all that NYSEC has meant to me in my time as county executive and in my time in county government. And to my colleague in Ulster County, the Honorable Patrick Ryan. There was a time, Pat, when I was a new guy on the block. It didn't seem that long ago. And I had darker hair too then. I mean, but, you could see after 4 terms if you know what it looks like. But I want to thank Pat not only for obviously his service as county executive, but his service to our country, which is outstanding. And thank you, Pat, for all you do and what you've done, and Mark and all of NYSEC, and especially my great friend, who I've been friends with for 30 years plus, Steve Aquario. So I want to thank all of you for everything you're doing. And, as we talk about this, and as I'm glad to be a part of this seminar, and in particular, honored to be asked to participate with Patrick in this workshop on leadership in the time of COVID-19. Certainly what you're going to hear from me, some of the same things that my good friend Pat Ryan had talked about what we did, because also in terms of this, our communication with each other as county executives throughout the state, as it's ongoing anyway in normal times, obviously gets stepped up a lot in terms of when crisis is striking, and we've been fortunate at times because those crises have been more isolated, whereas this one was wide-ranging, so we were all dealing with the same things at the same time, and the communication between colleagues is so important at this time. And I think, in leading it off, I just want to say that is a key piece to leadership, in particular, in looking at whether it's this particular situation, which everybody was impacted by in the same and some different ways, but basically the same at the same time periods. And really that communication and that openness of, and I'll say it, stealing ideas and borrowing and sharing best practices and all of that is so essential, and it really is a part of as we have done so many years in leading throughout New York State, and county governments have been at the forefront. And county governments, and I'll give that pitch as well, which obviously I'm speaking to the choir in terms of NYSEC, but if anything, this COVID crisis, and not unlike other states of emergencies that I'll get into a little bit, has really pointed to the leadership that county government takes, not Anthony Pacenti or Patrick Ryan, but the entire group of people that are in county government, that are on the front lines of things each and every day, that are so essential to the well-being of our community. We've had states, I've been, as Mark said, I've been county executive 14 years. And I have seen my share of different states of emergencies. And obviously, a lot of those have centered around Mother Nature and weather. winter storms, flooding, rainstorms, the tornadoes and different things that have struck in small communities in my particular county over the years. And in areas of those situations, we declare a state of emergency, which again, we've done in this case and are still in. And the difference in that and the difference that we were faced with COVID-19 was in those other states of emergencies, maybe they impacted part of the county, maybe the entire county in terms of a winter storm, a flooding situation that was in different pockets throughout. We dealt with that. We declare a state of emergency. It impacts certain areas. We work over the next 30 days or what it takes to fix and clean up and get back in, and life moves on. And for some of the other areas that are not impacted, the state of emergency means nothing other than they know that something happened in a community. I have 3 cities in my county, 26 towns, 17 villages. So when you spread that all out, you can see that different things happen in different areas. And our county is geographically, while we're not the largest, obviously in population, we are geographically one of the largest. So with that, now we're facing COVID-19, in which, as Patrick said, we've been tracking at the end of last year and the beginning of this year and watching what was happening. And then in March, things started hitting home, and especially when downstate, in downstate counties like Ulster and others, we're starting to see the impact, and things were happening on that level that we were so well aware of. And so in doing so, being in upstate New York, we're a little bit different, in terms of the movement of the virus, but nonetheless, the fear, the concerns, and the issues that we were facing. So just like we were, as Pat said, with Ulster and Dutchess and in Orange County, we also closed schools on March 13th. So for us, the state of emergency began on March 13th. And I recall, we closed schools, and I talked to, I think, Mark Molinaro that day as well, because when they were getting ready to close schools in Dutchess County and others, and we took that action, and we had yet to have a case. I know that Patrick said he had a case on March the 12th. We had yet to have a case, but nonetheless saw the urgency and let's attack this, as quickly as possible, and we did that. And the first step was closing schools, closing senior centers, the things that were closest to this virus in that initial phase that we saw. But I recall we're driving home that night and coming in on the next day, which was a Saturday, which the days just blended for months because they were just 7-day weeks and continued and continued and continued. But I remember driving in that day or the sleepless night that night before, and just thinking about the state of emergency, that what we had done. And so I'll go back to the storms for a minute. When you have a storm, when you have a flood, when you have things happening in the community that people can see, they can react to those states of emergency. We were in a state of emergency that people hadn't seen. And in particular in my county, no cases had been discovered yet. And even so, though Ulster County is not far away and New York City is not far away, it's still far away in people's minds that things are happening in other places and not here. How do we address that? So I felt we needed to address it head on very quickly and be prepared. And like my colleagues in other parts, began immediately putting those pieces together, putting together the briefings that were so important for our community, so important for our people to understand what we were facing. And why did we close schools when we didn't have a case? Why did we close senior centers when we didn't have a case? Why were we taking actions in terms of closing other aspects of municipal government in different areas and public spaces until that time? And that had to be explained. So the first thing we did was got a meeting together with all of our health experts, and that meant all the hospitals in my county, and brought them in for a meeting face to face, how we were going to attack this, what testing we were going to do, all the things that other communities had done, and outlining those aspects of it. And then looking to and briefing the community on those actions and reactions as they were put forth. And much like Patrick said, going through a series of planning and reviews of which are so important in looking at this. And as experienced in state of emergencies, knowing that we got something that's totally different than others, because this one was going to be with us in a longer period of time and needed to be explained to people even more thoroughly than the storm that they could see or the flooding that they can be impacted by. This was that hidden emergency that slowly would approach us. And by March the 21st, we had our first case, and that's when everything changed. And things got more, I don't want to say easier to explain, but people saw the urgency in that when the numbers started to grow and climb in cases, and identification of particular situations became more and more important. Businesses got closing, and again, we were ahead of the state. Counties were ahead of state government, and that's not a criticism. It's about the experience that we had in dealing with emergency situations on the ground, firsthand, closest to the people. And we were able to do that. And so the same way that, and as I said, I'm going to repeat this, we had to establish, different avenues for our people to get information, besides the daily briefings that we were doing, besides the press releases, besides the social media posts that were ever going. A helpline, not a hotline, first a helpline for those, because now we were closing schools. People needed help with daycare, other questions, things that were not immediate emergencies, but needed that. The hotline in the health department, which is still open today, continued to take, as Patrick said, in their county and ours, thousands of calls on a daily basis as what situations people were dealing with in terms of this crisis and how to address it. So all of those things, hotline, helpline, a mental health line. We knew there were a lot of people out there, and mental health being a real issue in terms of normal course of business in county government. But now you have a lot of seniors that live alone, that maybe didn't have the family around, that also needed the outreach with the Office for the Aging and our DSS offices and community care. People who were isolated, who needed to have a hotline to call for mental health. So we established that. We began working with our businesses, those that were allowed to be open, in terms of best practices, what they should be doing. I thought about this one, and Patrick shows that slide in those early days. Nobody was wearing masks, Patrick. Nobody was doing that. And that was because we didn't know what we were dealing with. We knew we had to buy PPE. We knew we had to get gloves and masks and other areas of personal protection. But we thought that was solely for the hospitals, for the nursing homes, for our first responders. Nobody thought about it in terms of the offices right away until things started growing, and then we had to buy more of that. We set up a consortium of PPE buy with our businesses so that they could get the best possible price, so that we could make those sales. We could make the buy for them in doing that, and we bought hundreds of thousands of gloves and masks and things at a price that was well below what everybody if they had to buy them individually, and everybody did that, and that was a struggle. So buying that, the county led those things. Dealing with just on the daily briefings, letting people know, and showing the confidence I think that we had as a county government in terms of what we were doing, why we believed it was the right thing to do. Patrick cited Dwight Eisenhower, and I'm reading, it's interesting, Pat, I'm reading Eisenhower's book now, is Ike, which is an American hero and leader. He's one of my heroes in history, reading about it. And I also look at his lessons on leadership. But I'm also, I also watch a lot of movies and movie buff and take quotes from it. And one of the movies, which is a movie that is called Remember the Titans, which is a great movie in terms of a lot of social issues, but a time of turmoil, but that people came together. But one of the lines in there is about leadership. And the line is about attitude reflects leadership. And we believed and still do, and everyone that when we walked out there for those briefings, we needed to be confident. We needed to have that empathy that Patrick spoke of. We needed to have that deliberate calm that he also put on his slide, because people needed to know that we were confident with what we were doing. And that was so important during this crisis, that we were able to answer those questions, as Pat said also, that we knew, and the ones we didn't, that we found out about. But also that, as I stood up there, my health director, who's experienced, with 40 plus years of work in a hospital as the trauma director of our main hospital here, and then came to work for us, wealth of experience. That was the expertise that was heard from. So because people needed to hear from her, and when in terms of that on a direct basis, working with the hospitals, the doctors that we brought in to discuss things, hearing from people that understood what we were dealing with, even when there were so many unknowns and things that were going on. So we tackled all of these issues head on, and again, continued, made tough decisions that many people didn't like, closures of different areas, even before the state did. We put a mask order. Oneida County was the first county to put an actual mask order in with penalty. In fact, it was almost, I joke about it today, but not at that time. When we sent it to the state for approval, they denied it at first and said we couldn't do it. And I went forward anyway with it. And a week later, the state followed suit across, and on a statewide basis. We took those actions, not to be not to be harsh, but to keep those numbers down. And the governor had said it, the president had said it, all levels had said it about flattening that curve. And the point was to get ahead of the curve, and to get beyond, to get in front of it, so that the curve wouldn't spike up and that we could get it down. And we did that. And we did that, and other counties did that as well. And so, the issue was, how do we get out in front of it? How do we make sure that our residents are comfortable with what we're doing? Maybe not like every step of it. And, I know that I'm sure that Patrick has heard from residents when they were unhappy with certain decisions that were made. But then the others that were, the hardest thing, I think, for us, or for me, and there were lessons, there were still lessons even today, that we look at in terms of this, crisis and where we've been. I've gone through, I don't know how many legal pads of daily notes of everything that we worked in, that, I still go back to and look back at different times of what we did, what we needed to do. And also made a list of the things that were, that I saw as shortcomings during it. It opened up our eyes to, our emergency process, where we, had we put everything in place, or did we look at things the way we should have, because of the exposure that this emergency, unlike any others I've ever dealt with, or that, generation has dealt with, in terms of the global aspect of this, that, that none of us had ever seen. Were those enough? Did we need more? Did we have enough supervisory training within our government? I have 1,700 employees. Did we have enough supervisory training, or do we, in terms of this? Because this is an all hands on deck situation. This is not about just the county executive's office, or just the public health office, or just the emergency services office. This is about every office in every aspect of county government. So did we plan well enough? And if not, what do we need to do? And how do we continue to do that? Did the technology piece that we're using today, was that up to speed given this situation, that all of a sudden we were going to a new realm of doing business, communicating with people, not just within our government, but on the outside, the manufacturers, the retail establishments, the restaurants, the back office operations, the financial institutions, all of those calls that we had with all of those different sectors to help them and to let them know that we were with them to guide them through. Those are things that we did throughout this, and continue to do even today. And even as we got into reopening, as confusing, as crazy as that was, and perhaps somebody saw me a couple times on my frustration on that, with the timelines that were set. but they needed to have that comfort level that we were looking out for them also. And we were fighting for what we could get done and what we could reopen safely. And we continue to do that today. So a lot of lessons. I mean, and clearly I'm sure we could both go on for another hour in terms of talking about what we learned and what best practices are. I mean, we again instituted so many other things and really also had to keep an eye on what does the future hold at a time also when in terms of county government, while we were doing all this, obviously our revenues and we didn't, and I know Patrick didn't touch on that, but I mean, because we're trying to avoid that at times in discussion, but our revenues are down while we're spending more money, unlike any other level of government. And with all respect to the cities, towns, and villages, and I'm not talking about New York City, it's really a county government unto itself, but county governments have expended more, have done more, have worked more than any other level I know in my area and throughout. And with that is faced the harshest and the hardest hit areas of our financial situation, be it on revenues and be it on expenditures. And what does the future hold? So in addition to dealing with the pandemic that is ongoing, as Pat said, and we know, and as we sit here and talk today, what does the future hold? How do we prepare? How do we continue to run a government, but also what do we do for our economy? Taking the next steps, reconnecting with people throughout the state and keeping those projects that we had ongoing at the beginning or that we're working at the beginning of this ongoing so that there is a future after COVID or even through COVID for our economic situation. We're building a new hospital. We're building a new chip fab plant. I mean, those things had to continue and we kept those continuing and we need to keep working towards that end as we go through this. So all of these things, keeping statistics, sharing information, all of them were important. The best lesson, and I could give about this, goes back to, I think, at the very beginning, in terms of if we're talking about leadership, and I'll take, it's not about, again, like I said, about Anthony Pacenti, and I'm sure Pat Ryan would say the same thing. It's about really the attitude reflecting that leadership with our community, giving our community the sense that we were in control and dealing with a situation that all of us, and not having all the answers, but understanding that it was a different time. But also, and so I credit, and I'll do the same thing that Patrick did, talk about my team and say what a great job we did, or they did, in terms of carrying out this and continue to do today. We're still working 7 days a week in all of these other areas, which, a lot of our work in county government is 7 days. We're continuing to do that. We will continue that. But also I want to thank the residents because they were the ones that also came through in the harshest of times and continue to do so. As we deal with schools reopening now and colleges, another phase of this crisis, again, county government really has the wherewithal and the tentacles to reach out into the community like no others. And all of our work ahead of time has prepared us in that regard. Our financial strength, our practice in emergency response and tabletop exercises, Pat says, are so important. And I stress that you can never do enough of that preparation, at times and even during this time. And, when there's a mistake or a slip up, you move forward and fix the problem, not the blame, and then go back and look at what we need to do the next time so it doesn't happen. Those are the lessons from this. And again, much more to learn. I'm sure that as we go through this, we'll do this again and have an even longer list of things that we can point to. But again, I want to thank NISAC for allowing me the opportunity. I look forward to any questions. I want to thank Pat Ryan for his leadership and all that NISAC has done in working with us and providing assistance throughout this process. Thank you.
Thank you, County Executive. One thing I wanted to stress that you talked about in your presentation is that counties led during this. We led the local response during this pandemic, and sometimes a decision that you made, that you talked about making, ended up being incorporated by the state and then became a statewide action, right? So counties were leading, and we were showing the way, and others were listening and reacting accordingly, and making it a statewide initiative. So thank you for that. We do have one question at this time that I would like to now ask. It's inspiring to hear County Executives Ryan and Pacenti describe how they innovated county government in ingenious ways. My question is, with so many new roles and ways of leading and operating that your counties developed during the height of the crisis, are there some that you believe will permanently change your government operations, and others that are temporary and will return to more traditional forms? So is there anything that you learned that will continue on after we are back to the new normal?
Yeah.
I'm happy to, either way. I will say quickly for me, and I will say, by the way, I've been tweeting the hashtag throughout this, so I might have a running lead on everybody else for that prize, but I hope anyway. But for me, I think the big one that were is this idea that we started a hotline, we expanded the role to these other services, and we're now calling it our Recovery Service Center. And this idea that you know, for many of our residents, it's like a maze to sometimes navigate our different departments and services, and how can we bring that all together and have an easy access point where then I and other leaders can track and make sure our response is actually responsive. That's something we're definitely going to continue. And as we face budget pressure, by the way, that we all are facing, as County Executive Pacenti said, we're going to have to be more efficient, create those synergies, and do more with less. So I think I see that as one of the ways that we're planning to do that.
Great, thanks. County Executive Pacenti.
Yeah, I would echo that and go on to say that we've looked at different best practices, and clearly a lot of what government is always different than the private sector in terms of things, but we've been able to incorporate some of that into government, unlike we've been able to do before, because you're always perceived in a certain way of doing things that government is expected to do in that way. But we have experienced that we can have some a great number early on, especially in terms of working from home. That's been a big topic, I know, with every industry, and even obviously has changed the dynamics, and even in county government, where it was unthought of that could even be done in a government setting, as something that we've been able to provide flexibility around. And in doing so is provide more efficiency in certain ways because of traffic, and I mean traffic in our buildings, and because of access points and all of the different things that we're doing. So a lot of those areas are different for us now. Again, communication is different, outreach is different, but I think it also has exposed different areas that we need to do a better job on. And I say that internally from my county's perspective, and understanding even more so. I mean, we know that homelessness becomes a problem, and then what do you do in a pandemic? Daycare demands become a problem, and what do you do in a pandemic? And especially when you have schools closed. So it did expose some open areas that we need to do more work on, and we are doing more work on today. And I think that those are going to be things that are going to change in the scope of how county governments react, or how they do business on a normal course of business going forward.
Great, thank you. That's all we have for questions. Before we conclude this virtual fall seminar workshop, I want to again recognize our sponsor, Siemens. Also, I want to give a big thanks to our speakers, Ulster County Executive Patrick Ryan and Oneida County Executive Anthony Pacenti. Your leadership is representative of the great work the county leaders did across the state and continue to do during this COVID-19 pandemic. I also want to recognize, and both of you recognize them along the way, want to recognize all of the unsung heroes at the county level who led the local response to COVID-19. Our county health directors, our county administrators, our county board chairs, our emergency management directors and personnel, our mental health officials, our budget officers, and all of those who have played such critical roles in fighting this pandemic and responding to the economic recession that followed. Thank you all for your tireless and ongoing work on behalf of your communities and on behalf of all the residents of New York State. This will conclude this afternoon's webinar. On behalf of your NYSAC team, we wish you all the best. Take care and be healthy.
Thank you.